All right, here we go. Stefan Hartman here, Iron Direct Primary Care. I'm joined here today by Katie Ainsley of Thermography of Brevard. Katie, thanks for joining me.
Thanks so much for having me on.
Great. So today I'm going to learn a lot about thermography. It's an area that I really didn't learn about in school. Katie, can you tell us a little bit about what thermography is?
Yes, so thermography is a digital infrared thermal imaging. So in simple terms, it's a picture. We're capturing the heat patterns on the skin surface, and those patterns and those heat patterns show where there's dysfunction in the body. So it's simply this camera right here that takes a picture, and that shows the functioning or the dysfunction of the body symptoms. And that's how we can see what's going on. It's a screening tool.
Brilliant. Amazing. I'm going to share my screen here. And share. So in school, I learned a lot about mammography, and I really didn't know thermography existed up until patients would bring it up, and I learned about thermography of Brevard locally. In school, we were pretty much focused on the screening guidelines of mammography. The World Health Organization, the Canadian Society, everyone's got a guideline for mammography. I haven't been able to, though, find too much guideline for thermography. When would you say patients should screen with thermography?
So we do recommend that females start their breast screening at the age of 25 and continue annually. The reason is that thermography is looking for subtle changes in the breast tissue. So the earlier a woman starts and the more frequent of scans that she has is the best and earliest detection. And when I say detection, we're not meaning detecting cancer. We're looking for those changes that would alert us that there's a problem that could potentially turn into cancer. So thermography is not a diagnostic. It is not a test that we have done to say you have breast cancer. It is a screening tool to help with prevention. So the minute we see a change or abnormality, then that alerts the patient to know that they need to be proactive about their health, and they need to make some serious changes, whether it's dietary changes, environmental changes, reducing stress and toxicity, because all of those things can promote cancer and cancer growth. So the minute there's a concern that we see it with thermography, that should really alert the patient, if they're not already being proactive on their health, to start being proactive and take their breast health seriously in order to prevent a diagnosis.
Very cool. I was reading one of your reports on a mutual patient recently, and I saw you reported estrogen dominance likely, and you were able to see this from thermography. I thought that was amazing because in my practice, I test salivary hormones on women and men. In women, I'm seeing estrogen dominance so often. What is going on here?
I do think it's a lot of the foods that we eat and the environmental toxins really increase the body's production of estrogen. And so, as you know, drinking out of plastic water bottles, or the increased use of plastic for storing our foods, or when people heat up food in plastic containers, that releases toxins that the body then looks at like estrogen. And so that increases the estrogen in the body. And then the foods we eat, if you look at the back of packaged foods, which are so bad for you, you see soy lecithin or soy this or soy that, soy oil, and that's the same thing. The soy can help the body increase with the estrogen production. So we're just bombarded with that in our environment.
We sure are. So one of the things I learned early on in my medical training was there's an overdiagnosis with mammography. And so what happens, you put the woman through the mammography and they get this, positive, but it doesn't mean they have cancer, right? You need to go to further testing. You need to do biopsies because there's a lot of anxiety towards a patient. What are the chances of you doing thermography? There's overdiagnosis as well.
So since it's not a diagnostic test, um, the odds of there being overdiagnosis are very small, the percentage, the risk of that. But what we have found, and this is a big confusion for clients for me, is that they might come in for their annual scan and it be at low risk. And then they'll have a next one and it might increase to some risk. So then they run out thinking that they have breast cancer and they'll go have a mammogram, they'll have an ultrasound, they'll have a biopsy, and all of those come back clear. There's nothing there. And so then they think, well, thermograms failed me. When in reality, what that some risk is saying there was a change from the initial one that showed low risk, and now the risk factor increased. And that risk factor means that they're at risk for future development. It doesn't mean something there's right now. Remember, it's a warning sign saying you need to change some things in your life. So that would probably be the only misunderstanding that could be labeled as overdiagnosis, is people not understanding really what thermography is, what the report is, and how it can be used to prevent.
I see. Yeah. Like, for example, detecting estrogen dominance early, my theory, from my understanding, from my cell library testing, I'm seeing this so often. I mean, I know from my training, if you're having estrogen dominance, that can lead to all sorts of estrogen sensitive cancers, right? Breast cancers, ovarian cancers, and so forth. It seems like thermography can detect on these early signs of it if you're looking at those type of cancers in the form of precursors being estrogen dominance, for example.
Right. So then so regulating the estrogen and getting that under control so that it is not dominant, so the progesterone's increased or the estrogen is reduced, or basically their hormones are in balance, then that really reduces the risk of those other type of cancers, those hormone-driven cancers, including breast cancer, correct?
Exactly. And I feel like no one's looking at it from this angle.
Very few are.
Very few are. Yeah, and then there's plenty of false negatives with mammography as well. So that is probably why in mammography they need to do it so frequently. It is not a diagnostic test, also similar to thermography. It's more of a screening tool that we use. But there are false negatives with mammogram as well. What percentage of false negatives do you get with thermography?
Oh, I should have had that number up for me. I would have to look that up. Off the top of my head, it's hard to say. Again, since it's not a diagnostic, since it is a screening tool, again, we can't really say, since it's not diagnostic, we can't say, okay, thermography detected breast cancer, thermography did not. However, if we're talking about the reports that come back at low risk, meaning no concern, but there actually is something going on there in the breast, we do have that, because there is not a test out there that is 100%.
Right.
Mammograms are not, MRIs, ultrasounds, and thermograms are not 100%. The only surefire way to say yes or no is a biopsy, a tissue biopsy. So we have had some reports showing that there was not any increased vascularity, there was not any physiological changes in the breast, and there was not any dysfunction or abnormalities. But in reality, there was breast cancer growing. They're very, very few. And the instances that happens is when that breast cancer has been there so long, the body no longer recognizes it as a foreign substance. It's assimilated into the body, and the blood flow there's no new blood flow patterns going there. It's just being fed. Everything is stable because the body no longer is fighting it like it's a foreign substance.
So other issues with mammography that came up pretty recently was vaccination. COVID-19 vaccination was causing adenopathy, so lymph node swelling. A lot of false positives with mammography, so much that a lot of people were advising not to do mammography for women in these cases. The other issue with mammography was radiation. I have a lot of holistic minded parents, moms in my practice. They're worried about the mammography radiation, and although it's supposed to be low, I think cumulatively over time screening, it's a decent amount of risk to put into perspective. It doesn't sound like thermography has these problems associated with it.
Right, there is absolutely no radiation or any contraindications with thermograms. It's perfectly safe for any and everyone because it is taking a picture. So if you're comfortable taking a picture with your cell phone or camera, then it's the same as the thermogram with the camera. So there is no risk for that, for radiation. There's no compression.
Right.
So what happens with the mammogram is the breast is placed in between, yes, two metal plates, and it is compressed with a lot of pressure. And then the picture is taken, and it's radiation. It's an X-ray.
Yeah.
And so the concern there is the pressure plates are now damaging the sensitive breast tissue because it has to squish them hard. And then when they're at their most vulnerable place of being squished, then the radiation is administered. And that over time can be concerning. Myself, being a breast cancer survivor, I try to reduce the amount of radiation I'm in contact with. When I go to the airport, I don't even go through those screeners. I opt for a pat down. I try as hard as I can to eliminate my radiation exposure. So it is a concern over time if a woman starts their annual breast screening with a mammogram at age 40 and has them every year till about age 60, that's 20. And then it's every other year, and then it's 5 years. So it's a lot.
It's a decent amount. I should ask, what do you do with your cell phone?
I do not keep it on me at all times. I try to talk on speakerphone, and I definitely do not have it by my bed. I turn it off or airplane mode as much as I can. Unfortunately, it is a necessary evil, but I do try to distance myself from it. Exactly.
One of the big points I like to point out with mammography is the number needed to screen to save lives. In this study, it showed that they estimate that the number of women needed to screen for 7 years to save one life over 20 years is 465. So you need to screen a lot of people to maybe save one life with mammography. Maybe up to 1,499. So yeah, I've been searching for a better answer than mammography. And I think maybe a combination of the two, but also salivary hormone testing, looking at the diet and toxins, looking at lifestyle, rather than just relying only on mammography, using other tools that we have at our disposal to predict this risk, because it's not just one thing that's going to predict it.
Right. And so I would never advise someone, I personally would never advise someone to not have a mammogram.
Right.
But what I'll say is a mammogram is a structural test, and it can only find something once it's there. There has to be a mass or tumor there for the cancer to be detected with a mammogram. Thermography is looking at the changes in the breast tissue at the earliest point. Breast cancer cells double every 90 days. And so over that time and over years, we're going to see if there's changes, if there's physiological changes in the breast, if there's increased vascularity, which means increased blood flow that is feeding the cancer cells and new blood flow. And those are going to alert us that there's a concern. And we can hopefully, in an average person, detect those changes 8 to 10 years prior to a mass forming. So thermography is all about prevention. So we really just want to do that, get it going so that we can see what's going on in the breast tissue and prevent breast cancer instead of waiting for a mammogram that needs a structure there. Because by that point, now it's a diagnosis. Now you have to go through treatment and surgery and whatever the person chooses. But now we have to fix it instead of prevent it.
That's my goal is to prevent things years before they happen. That's why I do advanced thyroid screenings, right? I don't just order a TSH, I order everything, right? You can detect thyroid peroxis, you can detect thyroid globulin antibodies 7 years before someone will destroy their thyroid, and you can make lifestyle changes. You can do supplementation to kind of prevent this autoimmune thyroid thing from happening.
Right. Yeah, it's all about prevention, and that's, and that's what I love about thermography for breast screening is that we don't want to wait till there's a concern and then say, oh, what is this? We want to be proactive in checking and monitoring so that we can actually stop it early on from
Yeah.
developing.
Is this a picture that you would see typically?
Yeah, it is very similar. Those are the views we do. We do 6 different views of the breast, the front and side views, diagonal views, and actually we image the back as well, because the patterns on the back can show if there's concerns with the breast tissue. So it's just really amazing how the body works and how all the systems function together. But when you have normal, stable breasts, the colors are going to be normally green or blue. Those are the cooler colors. However, they can also indicate if there is lymphatic congestion. And a lot of women have lymphatic congestion in the breast, especially in the underarm area, because they shave their underarms, they wear deodorant, and then just the motion of walking, the arms rubbing can cause those lymph nodes to get congested. And so thermography can show that, so the women can then be proactive about helping those lymph nodes get decongested and cleaned out, so that the blood going through those lymph nodes stay clear and clean, which then also helps prevent disease as well.
But on a side note, what sort of deodorant, if at all, do you recommend for clients?
Definitely no antiperspirants. That is so bad. Your body needs to sweat.
Yeah.
That releases toxins, and it is so good for you. If you want to do a deodorant, get a natural kind that just might help with odor, but your body needs to sweat, and it is helpful, especially around the breast. You want all those toxins to get out.
Yeah, exactly. Yeah, I was reading in the anti-aging book that I have about thermography, and what they were recommending was doing both mammography and thermography for screening. That's at least what they were saying, because I really can't find too many conventional guidelines that look at both thermography and mammography. That's what I found. But I think, using thermography, doing hormone testing, and then looking at overall lifestyle, nutrition, supplementation, and then looking at other toxins, right? So I do a lot of testing for heavy metals, fungi. So a lot of people live with fungal infections,
Right.
gut dysbiosis. I think these chronic inflammatory conditions can predispose to cancers as well.
Oh, yes, for sure. And also when you look at stressors, what is going on in your life, and how are you reacting and responding to stress? Stress can be a very big trigger to cancers because it weakens your immune system and overall just causes bad health. So there's so much more to look at than just the imaging, like you said.
Great. Okay, I think this was a great lecture. I think a lot of people will understand thermography a little bit better now and understand the screenings out there. And hopefully this helps some people.
So real fast, what I do for myself, everyone says, well, Katie, what do you do? You're a breast cancer survivor. I personally had a mammogram that did not detect my breast cancer. I was young. I was 33 when I was diagnosed. I did have dense breast tissue. And as you know, the denser the tissue is, the foggier or unclear the picture is for the mammogram. So it is easier to miss structures that are there for women with dense breast tissue. So as a cancer survivor, I do thermography for my breast. Well, I had a mastectomy, but I had a single mastectomy. So I do thermography, and then I have ultrasounds. And those two, because ultrasounds are a structural test and thermography is a physiological test. So those two combined, along with self-checks and of course, good diet and healthy lifestyle, that's how I monitor and take care of my breasts.
Love it. Sounds great. All right. Thanks. Let me pause here. Stop.